Well, you asked, and we're getting answers to your questions. We spoke with an infectious disease specialist about the coronavirus. Well, how long can a person carry the virus? And also, again, those symptoms to look out for. Channel 5's Taylor Winkle with our exclusive interview.
And we're joined now by infectious disease specialist Dr. Simone Wilds. Dr. Wilds, thank you so much for being here with us today. I know that you've been practicing for 23 years. You've cared for patients with life-threatening infections ranging from HIV to Lyme disease. So when it comes to coronavirus, just how difficult is it to diagnose this and to treat this?
Great question. So for coronavirus, the biggest challenge we have is the testing. So we have patients that come in and they have symptoms where they have the fever, they have shortness of breath, they have a severe cough and some body aches. We suspect it, but we are not quite sure, and so we have to test them. So we usually test for other viral infections such as the flu, and we also check a respiratory panel. And then if those are negative, we usually try to get approval from the state to get tested for the COVID-19. That was last week, but this week hopefully we'll be able to test them more rapidly.
And so this afternoon we watched as the president declared a national emergency, announcing more flexibility for doctors and hospitals when it comes to testing and telemedicine. In this instance, is this going to be reliable?
Yes, I think it will be very helpful for us because one, a lot of these patients where a level of suspicion is very high, then we can get more testing. Telemedicine will help us because we'll be able to access more patients quickly.
And we've also heard of major pharmacies opening up parts of their parking lots to perform drive-through screenings, kind of keeping those patients isolated in their cars. Is this going to be helpful for us as well?
Yes, it will be, because it prevents those that are really sick coming into the hospital and getting others sick. So I think if we can keep them separate and get testing done, it really will, for one, give us a chance to take care of other patients in the emergency room and just have easier access for those that are mildly ill.
And do we know how much worse this is going to get before it will start to get better?
Unfortunately, we don't have an answer, but we're hoping that we're going to be able to get in there and get control of this and test and get people better as soon as possible.
How long can it take to show symptoms? And is it true that some people don't even show symptoms at all that could be carrying this?
So the incubation period for COVID-19 is 14 days. We do have some patients that are asymptomatic, and by that I mean they're not showing any symptoms. So they don't have the fever, they don't have the cough, and you can think they are not ill, but in fact they might be shedding. But the ones that are symptomatic is usually 14 days.
All right, doctor, thank you so much for your time today.